Good day, I am Laika Berin, a student nurse from Nueva Ecija University of Science and Technology, Black Sea. And for today, I will be demonstrating cranial nerve assessment. The cranial nerve examination may reveal signs of sensory or motor dysfunction that could affect gait, decreased visual acuity, visual field deficits, or visual neglect that may cause a patient to adopt a cautious gait pattern and may contribute to falls. So, examination of the cranial nerve is an integral and important part of a complete neurological examination. For the assessment, availability and functionality of the needed materials, verify the doctor's order, client's level of consciousness and the level of knowledge and understanding, and assess the mental status or ability to participate in the procedure. For the planning, if possible, determine whether screening or complete neurologic examination is indicated. This impacts the preparation of the client, equipment, and timing. For the equipments, percussion hammer, wisp of cotton to assess light touch sensation, sterile safety pin for tactile discrimination, sugar, salt, lemon juice, quinine flavors, tuning fork, tongue depressor, paper clip, pen light, and clean gloves. For the implementation, prior to performing the procedure, introduce self and verify the client's identity. Explain to the client what you will do, why is it necessary, and how the client can cooperate. Perform hand hygiene and observe other appropriate infection control procedures and provide for client privacy. Inquire if the client has any history of the following: presence of pain in the head, back, or extremities, as well as the onset and aggravating and alleviating factors, disorientation to time, place, or person, speech disorders, any history of loss of consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory or mood swings, problems with smell, vision, taste, touch, or hearing. Cranial nerve 1, olfactory, ask the client to close their eyes and identify different mild aromas such as coffee and vanilla. Cranial nerve 2, optic, ask the client to read Snellen's chart and check visual fields by confrontation. Cranial nerve 3, oculomotor, pupils equally round and reactive to light and accommodation. Using a pen light and approaching from the side, shine a light on the pupil and then observe the response of the illuminated pupil. Shine the light on the pupil again and observe the response of the other pupil. Cranial nerve 4, trochlear, hold a pen light 1 feet in front of the client's eyes and ask the client to follow the movements of the pen light with the eyes only. Move the pen light upward, downward, sideward, and diagonally. The client's eyes should be able to follow the pen light as it moves. Cranial nerve 5, trigeminal, while the client looks upward, lightly touch the lateral sclera of the eye to elicit blink reflex. And to test the light sensation, have the client close eyes, wipe a wisp of cotton over the client's forehead. And the client should have a positive corneal reflex, able to respond to light and dip sensation, and able to differentiate hot from cold. Cranial nerve 6, abducens, hold a pen light 1 feet in front of the client's eyes and ask the client to follow the movements of the pen light with eyes only. Move the pen light through the 6 cardinal fields of gaze. And both eyes should be coordinated, move in unison and in parallel alignment. Cranial nerve 7, facial, ask the client to smile, raise the eyebrows, frown, and puff out the cheeks. Close eyes tightly, and then ask the client to identify various tastes placed on the tip and sides of the tongue. The client should be able to smile, raise eyebrows, and puff out the cheeks and close eyes without any difficulty. The client should also be able to distinguish different tastes. Cranial nerve 8, vestibulocochlear, assess the client's ability to hear a spoken word or vibration of a tuning fork, and then have the client occlude one ear out of the client's side, place a tickling, and watch 2 to 3 cm. Ask what the client can hear and repeat with the other ear. Client should be able to hear the tickling of the watch in both ears. Cranial nerve 9, glossopharyngeal. Apply taste on the posterior of the tongue for identification and ask the client to move their tongue from side to side and up and down. Cranial nerve 10, vagus. Ask the patient to swallow or speak. The client should be able to swallow without difficulty and speak audibly. Cranial nerve 11, accessory. Ask the client to shrug shoulders against resistance from the hands and turn the head side against the resistance from your hand. The client should be able to shrug shoulders and turn head from side to side. And lastly, cranial nerve 12, hypoglossal. Ask the client to protrude tongue at midline and then move it from side to side. The client should be able to move tongue without any difficulty. For the evaluation, evaluate the patient's response to the procedure and document the procedure and other important data on the client's chart.